This is Urban Health Today, and I'm speaking with Dr. Thomas So, clinical pharmacist at FDD. He's here to talk about the new weight loss and diabetes drugs currently available and the clinical research behind them. Thanks for speaking with me today, Dr. So.
Thank you, Tamara, for having me today.
Well, we're glad to have you, so let's get started. Can you give a brief overview of the landscape of obesity and diabetes in the US?
Yeah, sure. According to the Centers for Disease Control and Prevention, the CDC, the US obesity prevalence was 41.9% reported by the NHANES study in 2021. This was increased from 30.5% reported in 99-2000 time period. In the same time, the rate of severe obesity increased from 4.7% to 9.2%, nearly 1 in 10 Americans. Severe obesity is defined as a patient with a BMI greater than 40. The normal BMI for a patient with normal weight is between 18.5 and 24.9. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. It is estimated that the medical cost of obesity in the US in 2019 was nearly $173 billion. And medical costs for those who were obese was $1,800 higher than the medical costs for patients with a healthy weight.
Wow.
Yeah, for diabetes in the US, 37 million Americans have diabetes, or 11.3% of the population. This breaks down further to 28.7 million who are actually diagnosed with diabetes, while there's an 8.5 million in the US that are not diagnosed or even know that they have diabetes, according to the CDC. Besides those with diabetes, there's 96 million US adults who have prediabetes. So the normal A1C, the blood measure of your blood sugar control, is 5.7% to 6.4%. And those above 6.4% are actually considered pre-diabetic. And the higher the A1C, the greater the risk of developing type 2 diabetes. Complications from diabetes include eye problems, retinopathy, diabetic foot issues that can lead to amputation, heart attack, stroke, kidney problems, and even nerve damage, which can make it difficult for diabetics to walk even. In 2017, per the CDC, total cost of diagnosed diabetes in the US was $327 billion, of which 237 billion was for direct medical costs, and also 90 billion was from lost productivity in the US. And this was increased from 2012 by 26%, with an estimated cost back in 2012 of 245 billion for diabetes care. In 2017, that excess medical cost associated with diabetes on average was $9,600 per patient in the US.
Oh my goodness. Wow.
Yeah.
So how do GLP-1 receptor agonists like semaglutide help with weight loss and diabetes?
Semaglutide, it is a GLP-1 receptor agonist, and GLP-1 stands for glucagon-like peptide 1, which is a hormone that is naturally produced in the lining of your gut when you eat. It acts to regulate blood sugar levels by stimulating the release of insulin from your pancreas. And GLP-1 receptor agonists like semaglutide bind to that GLP-1 receptor in the body, activating the receptor, which leads to various effects on the body. For those treated with diabetes, semaglutide stimulates insulin release and also lowers glucagon release. And the two of those hormones together actually result in lower blood sugar levels. Additionally, the GLP-1 receptor agonists also slow stomach emptying after a meal, which lowers the peak blood sugar levels after a meal. And also another effect is that it makes the patient feel full, leading to lower food intake, which helps with blood sugar control. For those when used for weight loss, the semaglutide acts by reducing your appetite, leading to reduced calorie intake, and also the slowing of the stomach emptying can lead to that feeling of fullness, again, leading to reduced calorie intake. Lastly, it's believed that these drugs actually work on the brain in the appetite center as well.
That makes sense. So what are some of the main weight loss drugs available by prescription?
Well, other drugs besides the GLP-1 receptor agonists are orlistat, is a prescription medication that's used for weight loss. It acts by blocking an enzyme that breaks down the fats in your diet. This prevents the uptake of the fat, thus decreasing the calories from the fat from your diet. Combination product, which contains phentermine, an appetite suppressant, along with topiramate, a drug used to treat seizures and migraines. This combination works by reducing appetite and increasing the feeling of fullness. Another combination product that's available on the market in the US contains bupropion, which is an antidepressant, also used for smoking cessation. But when combined with naltrexone, a drug used to treat opioid and alcohol dependence, it works by affecting, again, appetite control and food cravings. A fourth drug that's been approved in the US, lorcaserin, it's a serotonin receptor agonist that affects appetite, thereby helping with weight loss.
So these are the drugs that are non.
These are not like the GLP-1 receptor agonists. Yes, these all work in a different fashion. Yeah.
Okay, so what are some of the GLP-1 receptor agonists on the market?
Other ones that are on the market are tirzepatide. You might have heard it under the brand name Mounjaro. It's also an injectable GL1P receptor agonist. And another injectable one, liraglutide, is Saxenda is the brand name for that one. And you'll even note there's also another drug. It's used for diabetes, again, Rybelsus. It's the actual oral form of the semaglutide.
Oh,
Yeah.
okay.
But
Well, that's a lot of drugs on the market. So how do the results of these drugs compare and contrast?
that's a good question, Tamara. A recent study published in the Diabetes, Obesity, and Metabolism Journal looked at the safety and efficacy of the drugs, the 4 drugs that I mentioned, along with semaglutide. And all of the drugs mentioned were found to have increased weight loss when compared to placebo. However, semaglutide and the phentermine combination resulted in the highest weight loss effects. They showed in their study 19 and 17 pounds weight loss, respectively. These 2 drugs also were found to have the greatest effect on reduction of waist circumference. They found 3 inches and 2.4 inches, respectively.
Wow.
Yeah.
How do they interact with common drugs taken by individuals with obesity-related health issues like hypertension or diabetes?
Yeah, you know, the GLP-1 receptor agonists, because they're used for diabetes, they also may increase the risk of low blood sugar or hypoglycemia if they're given together with other diabetes medications like insulin and sulfonylureas. But there really are no other specific drug-drug interactions that have been reported, but because these receptor agonists actually slow the stomach, there's a potential for interactions with the effects of other oral medications that you might be taking. Though in the studies that semaglutide did when they looked for approval from the FDA, they did look at other oral agents such as warfarin, atorvastatin, and metformin, and there was no need to adjust any of those drugs when they were taken along with semaglutide.
Okay, and what about the orlistat and bupropion and those classes?
Yeah, there are significant interactions between those drugs, especially if you're taking other serotonin agents, especially with bupropion. Orlistat, not necessarily, though again, similar to the fact that it can cause issues in the GI because it's causing you not to uptake your fat. There's potential for you not to also uptake drugs while you're taking orlistat at the same time.
Oh, wow. Are there any other weight loss medications on the horizon that you're excited about?
You know, there are other GLP receptor agonists that are in the pipeline. Many manufacturers are working on them. Several that I can name, orforglipron is a new class, along with danuglipron are 2 that the manufacturers have found is a different type of molecule. So it's actually easier for them to actually produce it in an oral form rather than injectable.
Oh.
Retatrutide is another similar drug that's on the market, or not on the market yet, but in research by one of the manufacturers. And their studies initially are showing a great improvement in weight loss. 15 to 20% range is what they're finding in their studies.
So beyond pharmacotherapy, are there other interventions being marketed for individuals struggling with weight management? For example, berberine, a lot of people are calling that the
Yeah, that recently there have been calls for the use of berberine for weight loss. It's a compound found in plants like golden seal, gold thread, European barberry, and even tree turmeric. It's been used for centuries in China and the Middle East for gastrointestinal issues, such as diarrhea. But the claims are that it actually helps to reduce blood sugar levels for those with type 2 diabetes. Unfortunately, there have been conflicting studies regarding the effects of the berberine. Because supplements are not FDA regulated for quality control, safety, efficacy, or regular monitoring, manufacturers are not required to establish the standards for these supplements.
Oh.
And so, at least not in the same rigorous manner that drugs which are approved by the FDA must go through. So you may be taking something stronger than what's on the label, or you may be taking something that just contains fillers and may have no active ingredient at all, unfortunately.
Even if it's compounded by you go to the pharmacy and they compound it for you, is that profile not safe either?
The things that you buy off the shelf, again, the FDA really truly doesn't regulate the content in those dietary supplements. So it really is, hard to, advocate their continued use. The other issue with berberine is that the berberine is found across the placenta, which can cause
Oh,
harm to an unborn baby, especially if you're pregnant. Yeah,
goodness.
it can lead to a condition called kernicterus. It's when the baby can't process all the bilirubin in its body, and it actually can lead to brain damage.
Oh my stars. How come nobody's talking about this?
That a lot of people talk about the good things, but they don't necessarily tell you about the risk necessarily.
Yeah, that's a huge risk.
Yeah.
So, how do you see the future of pharmacotherapy for obesity?
Well, like we mentioned, I mentioned those other GLP receptor agonists that are being studied by other manufacturers. I think that they'll be hitting the market in the future, in the next couple of years, probably. Though, this drug class is not without risk. Recently, the FDA had the makers of Ozempic add to the drug label post-marketing reports of ileus, which is an intestinal blockage, which is a condition that can actually be life-threatening. Now, granted, the number of cases is small at this point, but the FDA felt it was important to warn patients of this risk. And the hope of the GLP-1 receptor agonists as a magic bullet for weight loss, I don't know that there truly is a magic bullet for weight loss. Besides medications, you also have to, change to a healthy diet and also increase your exercise.
See, that's one of the things that I worry about. I worry
Yeah.
about people treating this as an
Uh-huh.
excuse
Yes.
to not take care of their health, to not exercise, to
Right.
not, follow a diet. I saw an article recently where a doctor was saying that with the advent of these drugs, that now she doesn't know how to counsel her patients as far as lifestyle changes.
Yeah. Yeah, I can imagine that being a difficult thing because you see on television these celebrities that are using this for weight loss. And a lot of times those celebrities don't need to lose weight. So the question is, are they setting a good example for the public by portraying the use of these drugs in that fashion? The other thing that you have to keep in mind when you're first trying to undergo weight loss is that you might actually see a weight gain when you first start the programs that you're trying to get into because you're trying to eat a healthy diet, but you're also increasing your amount of exercise. And what'll happen with increased exercise is that you'll actually lose fat, but you'll also gain muscle. And because muscle is denser than fat, you're actually going to see probably a mild weight increase as you're trying to lose that weight.
That's a
Yeah.
desirable weight gain because muscle
Yes, it is. It
room
is.
in fat.
Yeah, but I think it could be disheartening for a patient that steps on the scale and they actually see their weight going up when they're trying to do all these things correctly. But it's just a matter of counseling and letting them know, the fact that muscle is heavier than fat, and as you melt the fat away, that's when you'll see the significant weight loss.
Who are the best candidates for weight loss? I mean, obviously, if you have,
I,
A1C over a certain number, you're a
one
candidate.
in 10, 1 in 10 Americans have severe obesity. So, if you're in the severe obesity range, you're at the risks that I mentioned with heart disease, type 2 diabetes, cancer, and other things that I mentioned earlier. But yeah, so these patients should try to make those lifestyle changes.
Dr. Thomas So, thank you so much for your time today and your expertise on this. Really
No,
great talking to you.
no, thank you for having me.